నేను Dr. Madhavi from KIMS Cuddles, Secunderabad. I welcome you all to this session on women's health awareness and definitely opening of this health camp. First of all, advance Women's Day, International Women's Day to all. So మనము ఎందుకు సెలబ్రేట్ చేస్తున్నాము? ఫస్ట్ ఆఫ్ ఆల్ మన హెల్త్ చూసుకోవాలి, ముఖ్యమైనది. దట్ ఈస్ వై వీ షుడ్ గివ్ అవర్ సెల్ఫ్ అ గిఫ్ట్ ఫస్ట్ టు టేక్ కేర్ ఆఫ్ దట్. దిస్ ఇస్ ద బిగ్గెస్ట్ గిఫ్ట్ విచ్ వీ కెన్ గివ్ టు అవర్ సెల్ఫ్. అండ్ మోస్ట్ ఇంపార్టెంట్ ఇస్ బై క్రియేటింగ్ అవేర్నెస్. సో ఈరోజు టాపిక్ చూస్ చేసినాము థైరాయిడ్. What is thyroid? Nowadays a very general and common hot topic is thyroid. Thyroid, what is the problem with thyroid? Thyroid ante it is a small gland which is present in the neck, and it is a very small bilobe like a butterfly. It secretes a hormone which is called as levothyroxine. And that levothyroxine gland is hormone is very important for our body function ki. And body function ante every organ to paatu every cell also. So every cell function ki levothyroxine chala important. Danto paatu ladies ki, women ki, why it is so important? Because menstrual cycle happens every month. Once maturity వస్తుంది, మినార్కి అటైన్ అవ్వగానే రెగ్యులర్ మెన్స్ట్రల్ సైకిల్ ఇస్ ద పీరియడ్ అరౌండ్ 3 to 5 days ఎవ్రీ మంత్. బట్ థైరాయిడ్ అబ్నార్మాలిటీస్ వల్ల కొన్నిసార్లు దేర్ కుడ్ బి పీరియడ్ డిస్టర్బెన్సెస్, హెవీ ఫ్లో, లెస్ ఫ్లో, స్పాటింగ్. దీస్ ఆర్ ఆల్ పీరియడ్ డిస్టర్బెన్సెస్. సెకండ్ ఇంపార్టెంట్ థింగ్ ఇస్ యాజ్ woman is aging, reaching the reproductive age group, then they have fertility issues. Sometimes there could be suppression of ovulation. With thyroid imbalance valla ovulation will get affected. But then the myth is, yes, thyroid unte pregnancy raadu, asale kaadu. That is a very wrong notion. It is a myth. So thyroid balance anta correct ga normal levels, TSH anta normal check chestamo, ఆ లెవెల్స్ అంతా నార్మల్ ఉందంటే ఎస్, ప్రెగ్నెన్సీ ఇష్యూస్ ఆర్ ఆల్ సార్టెడ్ అవుట్. దెన్ నెక్స్ట్ కమ్స్ థైరాయిడ్. ఓకే, అర్లీ లైఫ్ ఆఫ్ ఉమెన్, ఇట్ కెన్ బి యాజ్ ఎర్లీ యాజ్ ఈవెన్ చైల్డ్హుడ్ అంటే ప్రెగ్నెంట్ ఉమెన్ క్యారింగ్ ద బేబీ కెన్ ఆల్సో హ్యావ్ ఎ కంజనైటల్ హైపోథైరాయిడిజం. సో దానివల్ల అంటే ఇన్ యూట్రో కూడా థైరాయిడ్ ఇష్యూస్ రావచ్చు. సో ఇన్ యూట్రో, young child, adolescent, puberty, and then reproductive age group. Sare, all levels are normal. Now what next? A thyroid impact later emaitadante manaki body welcome. Thyroid issues can have impact on the fat metabolism. Fat metabolism ante lipids, బాడీలో లిపిడ్స్ ఉంటాయి. కొన్ని గుడ్ కొలెస్ట్రాల్, బ్యాడ్ కొలెస్ట్రాల్ మీకు అర్థమవుతుండొచ్చు. హై డెన్సిటీ లిపోప్రోటీన్స్ ఆర్ ప్రొటెక్టివ్, వెరస్ లో డెన్సిటీ లిపోప్రోటీన్స్ దే విల్ ఫార్మ్ ఇన్సైడ్ ద ఆర్టరీస్. మన బాడీలో నరాలు ఉంటాయి. ఆ ఫ్యాట్స్ అన్ని పోయి లైనింగ్ లో సెటిల్ అవుతుంటది. ఓవర్ ఇయర్స్ ఒకవేళ మన థైరాయిడ్ లెవెల్స్ ఆర్ నాట్ నార్మల్, దెన్ ఈ లిపిడ్ మెటబాలిజం డిస్టర్బెన్సెస్ ఉంటది. And this will in turn lead to manaki cardiac issues ravochu, cardiovascular issues. This happens with aging process. Like lipids are high. So lipids high unte manaki we are at risk of heart diseases, coronary artery disease, and ischemic heart disease. These are all the complications of not taking care of your thyroid gland. Now ఫస్ట్ ఆఫ్ ఆల్, హౌ డు వి ఫైండ్ అవుట్ అంటే ఎట్లా డయాగ్నోస్ చేయాలా, మీకు ప్రాబ్లం ఉందా లేదా? బికాస్ దెర్ ఆర్ సో మెనీ ఓవర్లాపింగ్ సిమ్టమ్స్ ఉంటాయి. లైక్ సడన్లీ యూ ఫీల్ టైర్డ్, యూ టెన్ టు గెయిన్ weight gain because of no reason, that you are eating normally, you feel tired, weak, fatigue. So ilanti symptoms emana unte reach to your doctor who can definitely a simple test. ఇప్పుడు ఎట్లా డయాగ్నోస్ అవుతుంది అంటే a simple test of TSH and pre T3 T4 మనం టెస్ట్ చేసినామంటే మనకి తెలుస్తుంది your thyroid levels are normal or abnormal. One more thing, in pregnancy also thyroid has very important role because thyroid ki levels koni fixed untai. Early pregnancy like 2.5 up to 12 weeks, then second trimester 3 and third trimester 3. So these levels are very important because thyroid will again have impact on the baby's growing baby mental abilities. So ఎప్పుడన్నా ప్రెగ్నెన్సీ ప్లాన్ చేసినప్పుడు ఫస్ట్ గెట్ యువర్ సెల్ఫ్ కంప్లీట్లీ ఎవాల్యుయేటెడ్, యువర్ బాడీ ఈస్ ఫిట్ ఫార్ టు బేర్ ద చైల్డ్, అండ్ దెన్ వన్స్ దీస్ లెవెల్స్ ఆర్ నార్మల్, come and consult the doctor or a gynecologist or your obstetrician to know, yes, is my body ready to bear the child, first of all. So the doctor will give some folic acid supplements. Yes, once these are done, most of the time mana Indian scenario lo anemia is the commonest problem. Anemia is one of the foremost issue, is like mana dietary intake may not be normal. Whatever we are thinking, yes, this is quite normal for me, but manamu as a girl is going through all the menstrual blood loss, so every month you tend to lose hemoglobin, and that is how your hemoglobin will keep on dropping. So all cycles may not be normal. I mean to say, okasarti one period can be little heavier than the next period, or there could be some abnormality of prolonged periods. So like that, prolonged bleeding unnadante hemoglobin definitely will drop, provided me food intake it is not normal. So once in a year, once in 6 months, yes, you should have a blood picture check to know what is your hemoglobin. Now thyroid also plays a very important role in anemia, so both are interrelated. Like thyroid can lead to anemia, anemia can also, sometimes it might be a coincidence, not every time. So anemia is a very simple test which we can do. Most important, complete blood picture. Only blood picture, your hemoglobin may show as 12, but when we do the serum ferritin ante mana body lo konni stores untai to cope up with our regular menstrual loss. Yes, whatever loss is there is a store in liver. Our stores kuda manchiga normal undali so that your body can cope up with sudden any blood loss. So just doing a hemoglobin and showing 12 is not normal. You should have a normal good store. So ivannitki manam how should we adapt a lifestyle? Most important, diet in what way? Like if we make a circle of a plate, 1/4 is carbohydrate, next is protein, third is fresh fruits and your vegetables. So this on an average, your plate should be nice, colorful with lots of vegetables, fruits. So on an average, you should be conscious of what you are eating. Fruits, you can have dry fruits also, which will help you give essential fatty acids, what are required, calcium, and these are the important way to add, improve on your balanced diet, to take a balanced diet, to have complex. Refined processed food reduce on a daily basis, to reduce taking maida, besan, deep fried, processed, and always try to eat the freshly cooked food. Protein, there is a group with vegetarian as well as non-vegetarian. Simplest for our day-to-day life, egg is the simplest protein which you can add in your diet. Yes, for vegetarians, add multiple dals because one dal may not be enough to give you all the protein and amino acids మనకి అవసరం ఉండేటి ఆ అమౌంట్ లో సరిపోదు కాబట్టి మల్టిపుల్ దాల్స్ మనము యాడ్ చేసుకోవాలి డైట్ లో నెక్స్ట్ వన్స్ యు ఆర్ డన్ విత్ దిస్ see if not total week at least make 70% to get your meal in a more balanced diet. Second comes your activity. Activity, you start your day with nowadays we are all so busy with our day-to-day affair. So how do you manage your stress? So start with breathing techniques, meditation. These are all ways for stress management. Activity wise, start your day with stretches, top to bottom, from all the muscles should be addressed for stretching. Second, a minimum walk of 20 minutes or more, that will help to keep your body also. Most important, to maintain, it is a very big challenge to maintain a normal BMI. So what are the ways we can address the issue of thyroid? By your diet, avoid cabbage, cauliflower in your diet. Second is your activity. Exercise about 150 minutes per week is what the WHO says. That is the standard way. You should be active for about taking up vigorous. Those activities can be resistance, a little more moderate to vigorous exercises. These are very important. Second comes your stress management with the breathing techniques, pranayam, pursuing your hobbies. These are some ways to de-stress. Next comes your sleep schedule. Sleep schedule, try to maintain a good sleep cycle. Nowadays with our more addictive social media and phones, it is inevitable we tend to go through that. Now what happens, every time you open your cell, you see some images or some platform you reach, it is stimulating your cortisol. Cortisol is actually a stress hormone. Now what happens, you have to manage this stress. So just like aimlessly going through scrolling, ivanni habits konni restrict cheyala, so that this is also one way of stress management, because this again gives you, there is so much of pressure on youngsters and all to post their pictures, so maybe you can share all these things with the children at home also to manage your thing. Now addressing the diet, activity, sleep schedule and your stress management, then comes your what is the drug of choice, most common. Whatever, I simply say thyroid is not something a disease. Like if you make a curry, there is some salt less, you tend to just supplement, add little more salt in that. So it is to make it simpler, not to have that impact. I have some thyroid, I cannot bear children. So many queries we keep getting in our day-to-day clinics. So it is nothing like that. Just a dose of levothyroxine. Your healthcare provider, your physician will supplement with that, and that will help to get the thyroid normal and your levels. And at the same time, you have to continue with this way of lifestyle modification. Thank you so much for the patient here.